Hello everyone, clinicians. This is Nasseh, and I'm doing a video response to an email that was sent to me regarding the second episode of the Museum of Dentistry visit that I had with Dr. Brave, where we talked about dental chairs. And this generated a lot of emails, and I wanted to just kind of quickly address one of the issues that we had discussed there, which is basically about dental ergonomics. One of the things that we don't pay attention to oftentimes is really the way we practice. We're so concerned about the proper technique in surgical instruments and armamentarium that we oftentimes forget that the most important part of the practice is your own health and specifically your back health, because without a proper alignment and back, you're not going to be able to have a long career. Now, I've been in practice now over 20 years, Dr. Brave for many more years, although some of you have probably been in practice for longer, most of you have probably not been practicing for that long. And one advice that I wanted to share with everyone is the importance of back health, because this is just the slow wear and tear that kind of adds up. One of the things we don't pay attention to is that the positions in which we do our procedures, which is basically a seated position, is very unhealthy for the long run. For the most part, the lay down position where you are basically flat on the ground is the least amount of pressure on the lower back. In the lumbar and the sacral area, the intradiscal pressure when you're lying down is somewhere around 50 psi. However, when you stand up, that immediately doubles up to about 100 psi. But when you're seated, and even when you have proper posture, that is at about 250 psi. So we have a dramatic increase in the pressure, intradiscal pressure in the lower back in a seated position. Now, if you don't have good posture and you are basically, if you were to extend your legs when you're seated in a chair, your lower back intradiscal pressure raises up to as high as 850 psi. So imagine laying down being 50 and seated with poor posture with the legs extended being 850. So that is just a tremendous amount of pressure, which is unsustainable for a long career. So one of the most important things that you can do as clinicians is to really pay attention to this. As young clinicians specifically, you are the people that I'm trying to address here. You need to pay attention to this. Strengthening your core muscles, doing abs, doing some sit-ups and things like that are going to be very important for your career in the long run. I mean, you can learn how to do root canals, but if you don't have good posture, and you're never going to be able to extend your career to the length of time that it deserves to be. You will serve your patients better as well. Another thing is that efficiency of the work that you do will help you also in this process, because maintaining a seated position for any length of time is part of the problem. But when you are able to get up and stand up and change position, oftentimes you create some muscle confusion, and that helps reduce some of the stresses on your back. Stretching during your practice between patients is actually very helpful as well. One of the things that really helps is one of these big balls that you can actually lay down on and kind of try to reverse the overall pressure that is forward on your back. So anyway, I just wanted to kind of share this information with you. Just wanted to show that Real World Endo is not all about surgical techniques and pure armamentarium. We're also interested in you guys doing well in the long run and be healthy, and we hope that we can help in this way as well.